Now we are looking at the National Immunization Schedule. So this is with respect to India, and now to ask a few questions. So what is the BCG? So this can be broken down into when is it given and the dose and the route. So next is, what about the hepatitis B? So when to administer, then the drug, that is the dose and the route. Next is the rotavirus. So when is it administered, what is the dose and the route? So we'll find out answer to these questions and learn in detail about this topic. So first is we break down into different categories. So in case of the pregnant women. So in case of pregnant women, we use the tetanus. So this is given in case of the early in pregnancy. And the dose is 0.5 ml. And it is administered intramuscular. Next is TD2. So TD2 is given at 4 weeks after the TD1. So the dose here is 0.5 ml and this is also given intramuscular. Next is the TD3. So the TD booster. The TD booster is given if received 2 TD doses in pregnancy within the last 3 years. Within the last 3 years, if you have received, it is given. Next, looking at the doses. The dose is about 1.5 ml. It is 1.5 ml and it is given IM. So what we see here is that the tetanus, it is given in 0.5 ml and all the routes is only by intramuscular route. So next we look at the important infants. So in case of infants, firstly we are looking at BCG. In case of BCG, when to give. So when do we give the BCG? It is given at birth or as early as possible until 1 year of age. So it can also be given until 1 year of age. Next is the dosage. So how much is the dosage? So dose, if you see, it is 0.1 ml. And if not, it is 0.05 ml. And this is until 1 month of age. So it is 0.1 or 0.05 until 1 month of age. Next is, what is the route of the BCG? So route of BCG is nothing but it is intradermal. Then we look at the hepatitis B. So hepatitis B birth dose. So it is given at birth. So it is given at birth or as early as possible within 24 hours. Whereas BCG was within 1 year of age. So here the dose is 0.5 ml and in BCG it was intradermal, whereas in hepatitis B it is going to be intramuscular. Next, this is the OPV 0. So OPV 0 is given at birth or as early as possible, and this will be within the first 15 days. Within the first 15 days, it is immediately given. So what is the dosage? So it is given as 2 drops. And how is it given? It is given orally. Next is we see as OPV 1, 2 and 3. So 1, 2 and 3, the numbering is at 6 weeks, 10 weeks and 14 weeks. And it can be given until So it is given until 5 years of age. So there are 2 drops which are administered just like OPV0, and it is given orally. Next we have the pentavalent. So in case of pentavalent, there is 1, 2 and 3. So 1, 2 and 3, it stands for nothing but the 6 weeks, 10 weeks and the 14 weeks, and it can be given until 1 year of age. So until 1 year of age. So what is this pentavalent and what is the amount of dosage? So pentavalent, the dosage is 0.5 ml, and how is it given? It is given intramuscular. So till now we have seen one intradermal, that was BCG, and this is going to be intramuscular, that is a pentavalent. Next we focus on the rotavirus. So what is the rotavirus? It is given at 6 weeks, 10 weeks and the 14 weeks, and it can be given until, so it is given until 1 year of age. This is the nothing but the rotavirus. And how is it given? It is given orally. Then we look at the IPV. So the IPV, there are 3 fractional doses at 6, 14 as well as 9 months of age. And how is this given? The dose is nothing but 0.1 ml, and it is given intradermal. ID, that is 3 fractional dose. Next we look at the PCV. So what is this PCV? The PCV is given at 6 weeks, 14 weeks, as well as there is a booster at 9 completed months. So PCV, what is the dosage? So the dosage of PCV is 0.5 ml. And how is it given? It is given IM, that is intramuscular. Next comes the measles and the MR first dose. So this is given at 9 months to 12 months and can be given till 5 years of age. So can be given till 5 years of age. And what is the dosage? The dosage is nothing but 0.5 ml. And how can it be given? It can be also given, that is subcutaneous. Next we look at the JE, that is a Japanese encephalitis. So this is given at 9 completed months to 12 months. So what is the dosage? Dosage is 0.5 ml. And how is it given? It is given subcutaneous. It is given subcutaneous, that is live attenuated, as well as intramuscular, that is killed vaccine. So it is given subcutaneous as well as intramuscular. Then we look at, now we are looking at vitamin A. So vitamin A first dose. So this is given at the 9 completed months. And this is given along with the measles as well as the rubella. And what is the dosage? Dosage is 1 ml, that is nothing but 1 lakh IU. And how is it given? It is given orally. Next we move on to the children. So in case children, what is given? So there is the DPT. So DPT booster. So in case of DPT booster 1, it is given during the 16 to 24 months. And how much is the dosage? 0.5 ml is given, and it is given IM, that is intramuscular. Next is the measles or the MR2 second dose. So measles and the MR2 second dose is given at the 16 to 24 months, and this is about 0.5 ml and it is given subcutaneous. Next, we move on to the OPV booster. So the OPV booster is given during 16 to 24 months and there are 2 drops and it is given orally. Next is the Japanese encephalitis 2. So the JE2 is given at 16 to 24 months. And what is the dosage? It is about 0.5 ml. This is the dosing and it is given subcutaneous. Then is vitamin A. It is second to the 9th dose. And looking at the duration, it is 16 to 18 months. Next, it is followed by one dose, that is every 6 months, up to the age of 5 years, up to 5 years of age. So what is the dosing of this? So it has 2 ml, that is 2 lakh international units, and it is given orally. Next, we look at the DPT type 2, booster 2. It is given during 5 to 6 years and the dosing is 0.5 ml. It is given intramuscular. Next is the TD. It is given 10 years and also the 16 years. It is 0.5 ml. It is given intramuscularly. Now to answer our questions. So the first was, what is BCG and when is it given? What is the dose and the route? So BCG is given at birth and it is given as soon as possible until the 1 year of age, 1 year age. So what is the dosing? It is given 0.1 or 0.05 ml. This is only until 1 month of age. So this is nothing but it is intradermal, that is ID. Next, what we see is the hepatitis B. So hepatitis B is nothing but the birth dose. So here it is given at birth and as soon as possible within 24 hours. So within 24 hours. And the dosage being 0.5 ml and it is given intramuscular. So this was the second question. What is the hepatitis B vaccine? How is it administered and when? Then we look at the rotavirus. The rotavirus is given at 6, 10 as well as the 14 weeks. And it can be given until 1 year of age. Until 1 year of age. And how is it administered? There are 5 drops which are given and it is given orally.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.